Why most seniors die after a fall. 5 hidden dangers you must know. Falling. The word conjures images of childhood scrapes, a fleeting moment of clumsiness. But for seniors, a fall can be a life-altering event, often signaling a cascade of health complications that tragically lead to declining health and, in many cases, death. It's a grim reality. Falls are the leading cause of injury and death from injury among older Americans. But why is this seemingly simple accident so devastating? It's more than just broken bones. We often focus on the immediate aftermath, the hip fracture, the head trauma. However, the true danger lies in the hidden ripple effects, the silent threats that erode a senior's health and independence long after the initial fall. These are the insidious consequences that families often overlook, the underlying factors that transform a fall from an accident into a turning point. Are you truly prepared to safeguard the health and well-being of your loved ones? This article delves into the heart of the matter, exposing the 5 hidden dangers lurking beneath the surface of a senior fall. Understanding these dangers is the first step toward prevention and proactive care, empowering you to protect the seniors in your life and ensure they live longer, healthier, and more independent lives. It's time to look beyond the surface and arm yourself with the knowledge to combat these silent threats. Hidden danger number 1. The spiral of inactivity and deconditioning. The immediate aftermath of a fall often focuses on treating the visible injuries, a fractured hip, a sprained wrist, or a head contusion. But even seemingly minor injuries can trigger a devastating cycle of inactivity and deconditioning that significantly impacts a senior's long-term health. Imagine this. After a fall, even feeling a bit sore, your loved one naturally becomes more cautious. They might avoid activities they once enjoyed, like gardening, walking to the store, or even simply getting up to prepare a meal. This initial hesitancy is understandable, driven by fear of another fall and the pain associated with movement. However, this reduced activity quickly leads to muscle atrophy, the wasting away of muscle tissue. The less they move, the weaker they become. The muscles that support balance and coordination weaken, making them more prone to future falls. This physical deconditioning isn't just about muscle strength. Reduced activity also impacts cardiovascular health. The heart becomes less efficient, leading to decreased stamina and increased fatigue. This fatigue, in turn, further discourages activity, creating a vicious cycle. Furthermore, bone density can decrease with inactivity, increasing the risk of fractures in the future. It's a downward spiral. Fear leads to inactivity, inactivity leads to weakness, weakness leads to a higher fall risk, and the cycle repeats. Breaking this cycle requires proactive intervention. Physical therapy is crucial to rebuild strength, improve balance, and restore confidence. But beyond formal therapy, encouraging gentle, regular movement is essential. This could involve chair exercises, short walks with assistance, or even simply standing up and sitting down several times a day. The key is to find activities that are safe and enjoyable, gradually increasing intensity as strength improves. Addressing the psychological fear of falling is also vital. Cognitive behavioral therapy or support groups can help seniors regain confidence and overcome their anxieties, empowering them to return to a more active lifestyle. Remember, combating deconditioning requires a holistic approach that addresses both the physical and psychological aspects of recovery. Hidden danger number 2. Post-fall syndrome, the crushing weight of fear and anxiety. While physical injuries are the most obvious consequence of a fall, the psychological toll can be just as devastating, and often far more insidious. The fear of falling again, known as post-fall syndrome, can have a profound impact on a senior's mental and emotional well-being, leading to a cascade of negative consequences. Imagine the scenario. Your mother, once independent and vibrant, experiences a fall in her kitchen. Even if the physical injuries heal, the memory of that moment, the feeling of helplessness, the sharp pain, the sudden loss of control can linger, creating a persistent state of anxiety. She might start to avoid activities she once enjoyed, like cooking or gardening, for fear of falling again. This fear can extend beyond specific activities to encompass a general sense of apprehension about moving around the house, leading to social isolation and withdrawal. Post-fall syndrome manifests in several ways. Seniors may become overly cautious, constantly scanning their surroundings for potential hazard. They might develop a hesitant gait, shuffling their feet and relying heavily on assistive devices, even when they don't necessarily need them. This over-reliance can paradoxically increase their risk of falling by reducing their natural balance and coordination. The psychological impact doesn't stop there. The constant fear and anxiety can lead to depression, loneliness, and a diminished quality of life. Seniors may become withdrawn, losing interest in hobbies and social interactions. They might experience sleep disturbances, appetite changes, and a general sense of hopelessness. In severe cases, post-fall syndrome can even contribute to cognitive decline. Addressing post-fall syndrome requires a compassionate and holistic approach. It's crucial to acknowledge and validate the senior's fears, creating a safe space for them to express their anxieties. Cognitive behavioral therapy, CBT, can be highly effective in helping seniors reframe their thoughts and beliefs about falling, reducing their anxiety and restoring their confidence. Support groups can also provide a valuable sense of community, allowing seniors to share their experiences and learn coping strategies from others. Furthermore, environmental modifications can help reduce the risk of future falls and alleviate anxiety. This might include installing grab bars in the bathroom, improving lighting, and removing tripping hazard. By addressing both the physical and psychological aspects of post-fall syndrome, we can help seniors regain their independence, confidence, and quality of life. Hidden danger number 3. The increased risk of infection following hospitalization. A fall severe enough to warrant hospitalization opens the door to another significant hidden danger, an increased risk of infection. Hospitals, while dedicated to healing, can also be breeding grounds for bacteria and viruses, posing a serious threat to vulnerable seniors. Seniors are already more susceptible to infections due to age-related changes in their immune systems. As we age, our immune cells become less efficient at fighting off pathogens, making us more vulnerable to illnesses like pneumonia, urinary tract infections, UTIs, and skin infections. Hospitalization further exacerbates this vulnerability. Prolonged bed rest and inactivity, common after a fall, can weaken the immune system and increase the risk of pneumonia. Catheters, often used to manage incontinence during hospitalization, can introduce bacteria into the urinary tract, leading to UTI. Surgical procedures, such as hip replacements, carry the risk of surgical site infections. Furthermore, hospitals are often populated with antibiotic-resistant bacteria, making infections more difficult to treat. Seniors may be exposed to these bacteria through contact with healthcare workers, contaminated surfaces, or other patients. The use of broad-spectrum antibiotics, while necessary in some cases, can also disrupt the balance of beneficial bacteria in the gut, further weakening the immune system and increasing the risk of opportunistic infections. Preventing infections in hospitalized seniors requires a multifaceted approach. Meticulous hand hygiene by healthcare workers and visitors is paramount. Early mobilization, even if it's just sitting up in bed, can help prevent pneumonia. Regular monitoring for signs of infection, such as fever, redness, or drainage, is crucial. When catheters are necessary, they should be used judiciously and removed as soon as possible. Probiotics may be considered to help restore the balance of gut bacteria after antibiotic use. Advocating for your loved one's care is also essential. Ask questions about infection control practices, ensure that healthcare workers are washing their hands, and speak up if you notice any signs of infection. By being proactive and vigilant, you can help minimize the risk of infection and protect your loved one's health during and after hospitalization. Hidden danger number 4. The exacerbation of existing chronic conditions. A fall doesn't occur in a vacuum. It's often a tipping point for seniors already struggling with underlying chronic conditions. The stress and trauma of a fall can significantly exacerbate these existing health issues, leading to a rapid decline in overall health and well-being. Consider a senior with pre-existing heart disease. A fall can trigger a surge of adrenaline and cortisol, placing additional strain on the heart. This can lead to chest pain, shortness of breath, or even a heart attack. Similarly, a senior with diabetes may experience fluctuations in blood sugar levels due to the stress of the fall and the subsequent changes in diet and activity. Uncontrolled blood sugar can increase the risk of infection, impair wound healing, and exacerbate nerve damage. Arthritis, a common condition among seniors, can be significantly worsened by a fall. The impact of the fall can further damage already inflamed joints, leading to increased pain, stiffness, and reduced mobility. This can make it even more difficult for seniors to return to their normal activities, perpetuating the cycle of inactivity and deconditioning. Even cognitive conditions like dementia can be exacerbated by a fall. Head trauma, even minor, can worsen cognitive impairment and accelerate the progression of dementia. The stress and anxiety associated with a fall can also contribute to confusion, disorientation, and behavioral changes. Managing the exacerbation of chronic conditions following a fall requires a coordinated and comprehensive approach. Close monitoring of vital signs, blood sugar levels, and pain levels is essential. Medications may need to be adjusted to address the increased symptoms. Physical therapy and occupational therapy can help seniors regain their mobility and independence while managing their underlying conditions. It's also crucial to ensure that seniors receive appropriate support for their cognitive and emotional need. This might involve cognitive rehabilitation, counseling, or support group. By addressing both the physical and mental health consequences of a fall, we can help seniors manage their chronic conditions and prevent further decline. Hidden danger number 5. The cascade of healthcare costs and diminished resources. Beyond the immediate physical and psychological trauma, a senior fall can trigger a cascade of financial burdens that can significantly impact their quality of life and access to care. These increased healthcare costs and diminished resources can create a vicious cycle, further exacerbating their health problems and limiting their ability to recover. The initial costs associated with a fall can be substantial. Emergency room visits, hospital stays, surgeries, and rehabilitation therapy can quickly drain savings and strain insurance coverage. Even with insurance, co-pays, deductibles, and uncovered expenses can add up significantly. But the financial burden doesn't end there. Seniors may require ongoing home healthcare services, such as nursing care, physical therapy, and occupational therapy, to help them recover and maintain their independence. They may also need to purchase assistive devices, such as walkers, wheelchairs, or grab bars, to improve their mobility and safety. Furthermore, a fall can lead to long-term disability, requiring seniors to move to assisted living facilities or nursing homes, which can be incredibly expensive. These costs can quickly deplete their savings, forcing them to rely on government assistance programs like Medicaid, which may limit their access to certain types of care. The financial stress associated with these expenses can further exacerbate their health problems. Seniors may be forced to cut back on essential expenses, such as food, medications, and utilities, to cover their healthcare costs. This can lead to malnutrition, medication noncompliance, and increased vulnerability to illness. Addressing the financial impact of a senior fall requires proactive planning and resource management. It's crucial to explore all available sources of funding, including insurance benefits, government assistance programs, and community-based resources. Financial counseling can help seniors and their families develop a budget and manage their expenses. Preventive measures, such as fall-proofing the home, promoting exercise, and addressing underlying health conditions, can also help reduce the risk of falls and the associated healthcare costs. By taking proactive steps to protect their health and financial well-being, we can help seniors maintain their independence and quality of life.